Ohio does appear to be, with a number of states, to be at the center of this crisis. On average, one person in Columbus dies of a drug overdose every day. That is an amazing number. But it's not too different from Alabama and other places around the country. In 2015, across the United States of America, more than 52,000 Americans lost their lives to opioid overdoses, drug overdoses, and the number we have for 2016 shows another increase, a big increase. This crisis is being driven primarily, as you know, by opioids, prescription drugs, heroin, and synthetic drugs like fentanyl. And so to confront a crisis on this scale, we must take a comprehensive approach to the problem. There are three components, I believe, in an effective strategy: prevention, enforcement, and treatment. Treatment is important. It's critical. In some cases, treatment really breaks the cycle of addiction and crime and can get people's lives back together. We can and must do more, which is why today we are announcing a new effort to target our federal resources against this epidemic. If you are a doctor illegally prescribing opioids for profit, or a pharmacist letting these pills walk out the door onto the streets based on prescriptions you know are obtained under false pretenses, we are coming after you. We will reverse these devastating trends with every lawful tool we have. First, I'm announcing a new data analytics program, the Opioid Fraud, Abuse, and Detection Unit. I've created this unit to focus specifically on opioid-related healthcare fraud, using data to identify and prosecute key individuals that are contributing to this opioid epidemic. And I'm also assigning 12 experienced prosecutors to focus solely on investigating and prosecuting opioid-related healthcare fraud cases in a dozen key locations around the country where we know enforcement will make a difference in turning the tide on this epidemic.